All right, welcome everyone. Welcome to session 3 of Recruitment Boot Camp. And unfortunately, Michelle can't be with us today. She had another obligation, but I'm here today with you. And you may remember from the other week when Helen and I presented for you. So I'm Alex Rollwing, and I am a training specialist with the Star Center. And so if you have any bad things to say about me, you can say them to Michelle behind my back. But otherwise, I think we're gonna have a good time today. Michelle has prepared some really excellent material for you. So I think we're gonna have a really good discussion today. And I know there might be a couple more people showing up a few minutes late, but we are going to go ahead and get started with the preliminary stuff here. Actually, can everyone see my screen okay? All right, excellent. So I think everyone knows all of the Zoom functions and everything at this point in our lives, but obviously if you have any technical issues, you can certainly message Mariah Blake or me in the chat, or you can send an email if you're having some really major issues to Mariah at mblake@clinicians.org. And she'll be able to help you out there. Oh, and also, please remember to complete the evaluation. Those really help us out a lot. And obviously, we take the feedback really seriously. So if there's any way we can make things better, we definitely want to know about that. And let's get started off with a little Mentimeter question. This is one that Michelle found, and I didn't know the answer for this. This could be a tricky one. So just as before, you can use a smartphone and scan the QR code. You can go to menti.com and type in the code, or here's a link I just put in the chat, and you just click that, and that'll take you to the Menti survey. So I'll give everyone just another minute to get logged into Mentimeter, and then I will switch screens here so we can see the results coming in. All right, we've got some votes for 1999, 2022, 2014. This is like a wider spread than I was expecting. And so this has to do with, I had to read on this because I had no idea, but I guess in 500 AD, the Christian church reset their calendar a little bit, and Ethiopia, the Ethiopian church did not. And so they are actually a few years off as far as their calendar. Cool thing, they also have 13 months. So 12 of them all have the same number of days. I think it's 30. And then the last month has either 5 or 6, depending on if it's a leap year. So that's kind of a cool thing. So it looks like we have most people answered. Okay, let's go back and see what the answer is. There we go. And it is 2014. So they are 7 years behind ours. Their new year starts in September. So I don't know, fun fact to start the day. I thought that was pretty cool when Michelle shared that. And congratulations to all the people that knew 2014. That's pretty impressive. Okay, and now let me check. Our attendees, is Latrell here? Michelle was going to ask Latrell Floyd if you're here and want to
Yep.
share a little bit. Yeah, are you here,
Alex,
Latrell?
this is Suzanne.
Oh, yeah.
I see them.
Okay, excellent. Oh, someone had a lucky guess on Ethiopia's calendar year. It's okay, you don't have to tell us. You just tell us you knew all that. But yeah, Latrell, if you're here and would like to share a little bit about what your health center has been doing. Michelle let me know that you all have been doing some really impressive work with your community. And she was just going to ask if you wanted to share for a couple minutes about that.
Okay, yeah, I can. So yeah, as he mentioned, my name is Latrell. I'm a human resources specialist at White House Clinics. And pretty much when it comes down to recruiting, I know we have like a very kind of like a specific way on how we do it. So for example, the way our recruiting process works is we all have a system that we use. Right now we're using Paycor for recruiting specifically, which gives access to all of the hiring managers specifically for the positions that they're assigned to. And from there, the hiring manager and myself will look through the applications. And from there, if we decide to proceed, then I will set up a phone screening with them. And then from there, if it goes well, we'll set up a actual in-person interview, and that will be with myself and the hiring manager, and then someone more so that will be on the team that they'll be a part of. And from there, it gets passed over to other members of my HR team. Like we have a person in HR who does like their credentialing and stuff if needed. And we have a person who will actually reach out and actually make the offer. And that's the person who will also be over the orientation phase as well, which our orientation is 2 days. And then we also do some work in the community as well. We do a lot of collaborations with a medical school, a technical college here in Richmond as well. So pretty much it's not like a partnership, but it kind of is, kind of sort of. But pretty much how that works is there's students there right before they graduate, they'll pass their information over to us. And then from there, we'll reach out to them. And from there, if typically we'll do like externship, we'll offer them an externship. And if the externship goes good, then we actually offer them a position. And I believe they've been doing that for like, I want to say the last 2 years. I got here in August, so that's what I was told. They've been doing it for the last 2 years, and it's been going really good. A lot of our CMAs that we've gotten have actually came from that career and technical college. So that's been working pretty well. And then I've also reached out to some of like the universities around Kentucky for some of our, a few of our other positions, such as like behavioral health providers and specialists and stuff like that. So that's kind of like how our recruiting goes.
Excellent. No, that's really great. It sounds like one, that you have steps kind of divided out and tasks divided out between a whole bunch of people and like very specific assignments, which is really good. Like helps reduce the workload and people know, everyone knows what their task is and everything. And I really liked the that you have someone from the actual department where the person's going to be, where you're trying to hire for, in there, so that someone who really knows the job really closely is in there working through the hiring process. And then, yeah, the partnership with the technical college and everything, that sounds great. That I'm sure that's a really great source of candidates.
Yeah, it's a really big help.
Yeah.
Especially for, I don't know how it is for like other people, but I know with us specifically, sometimes we do kind of have like a hard time filling like our dental positions or like our EDA positions. And a lot of our externs actually come from that technical college. So that's like always like a really big like load off our shoulders when they actually come to us.
Okay. Yeah, that's fantastic. Yeah, and I'm sure kind of a reasonably easy partnership to maintain. It sounds like it's not a huge burden on you or the college, but both of you benefit a lot from it.
Yes, absolutely. Like they get bragging rights on saying like their students are employed and they're doing well. And then of course we get the candidates.
Yeah. Oh, that's really terrific. Well, yeah, thank you very much for sharing, Latrell. Really appreciate it.
Oh, yeah, absolutely.
Okay. And so, yeah, once again, thank you to Latrell. And then I think next we're going to go into breakout sessions. And so for the breakout groups, I'm going to paste the questions into the chat as well, so you can copy and paste them down. But in just a moment, we'll break out into groups. And I think we were going to do 15 minutes. Let me double check the time. Yeah, 15 minutes for these. And so if you want to discuss with the last homework that you did, what kind of challenges did you face? And also what were your successes? And then are you going to be adding any new people to your recruitment team or trying to reach out and work with any other organizations in your community? And when we come back from that, I'll ask each group to report out. I think we're doing probably 3 or 4 groups with the number of people we have. So yeah, each group will get a few minutes to report out when you come back. There we go. Welcome back, everyone. Hope it was a really good discussion. We heard some of the feedback about wanting more time, so we tried to give you a little bit more time to discuss this round. And we are going to kind of report out. It can be one person from the group, or everyone can pitch in, however you feel like. And if it's all right, we'll just go ahead and start with room 1, which had Angela, Elaine, and Carrie in it.
Trying to think, we talked about a lot.
No.
Let's see here. We talked about as far as the community engagement with like partners and recruitment within the community. In our area, it's a rural area, and so in fairly small. So any provider to the community, of course, is a benefit to the community. So when possible, like not when the resume isn't through like a contracted agency where we can't share it with another entity, we try to do group like sharing so the candidate can interview at multiple organizations. And we share the site visit costs that way. So like flight, hotel, those things, we're able to share those costs. And then ultimately the provider ends up picking where they're best suited. And for us, that works because we'd rather them start there than jump ship. And, you know, after you've hired them and we're a small community, they're going to get to know those places anyways. So it really is better that they just start in the right organization that fits them. So that was one thing. We talked about our different levels of recruitment teams and how we break out the different types of recruitment, whether that's by region or whether that's by, like in my world, it's there's staff recruiters who are broken out by region, and then I do provider recruitment, so all billable, but everybody has kind of different ways. What else? Somebody else remind me what else we do.
Yeah, that was kind of and I believe, Angela, it was you that had talked about the managed Medicaid program with the partnerships that help pay out bonuses and stuff. That was really interesting if you're in an area that allows for that and that provides that.
Yeah, our local managed Medicaid does very nice sign-on bonus and retention bonuses for our providers, so long as they're, of course, contracting with Medicaid in the community. So that's been a really helpful resource.
Excellent. Is there anything that you're going to potentially change about your recruitment teams going forward?
I'm really excited. I just got approval for a housing coordinator because housing is a really big challenge for us. And then I also got approval for a full-time physician recruiter. So yes, I'm really excited about my changes coming.
Excellent. And then were there any kind of questions or things you guys were discussing but didn't have an answer to, or anything that you would like as we go through the different groups, if anyone has input on it to help out with?
I don't think so. I think we talked about there was 3 of us in our group, and the employee referral program came up. And so 2 of us that were already doing the program, one of the other folks were starting that program. And so we were talking about like, if that's successful and amounts, what is the amount for staff versus provider and those things. So if other folks have input into that, feel free to share.
Terrific. Well, if that's it for group one, that was excellent. Sounds like you all had a good discussion and have some really good stuff going on. That's fantastic. So let's see, room two was Dorothy, Latrell, Laura, and Marissa.
So I am going to speak for our team here. So we talked about some of the challenges we were all facing. It seems like we're all facing pretty similar challenges, which includes the housing, finding dentists, staff for dental, and various other behavioral health and things of that nature. So those are some of the challenges we all talked about. As far as community partners go, it sounds like most of the group that I was in are currently partnering with schools in the area. I can speak for my organization. We are partnering with our community college, with the Workforce Training Center, where we're going to have a program for medical assistants and dental assistants to do apprenticeships through us. We actually have our first cohort starting now this month, which is really exciting for medical assistants. And then just partnering with any like the chamber and things of that nature to really build some relationships. We didn't get a chance to talk about our recruitment teams because we were talking about so many other things. But I can tell you from my organization, I've been the sole recruiter for the last 2 years. And we just recently hired a new recruiter. I'm so excited about that. You have no idea. And then we're adding on a onboarding specialist as well. So I'm super excited about that. I have requested a sourcer because I think having a sourcer would be a really great tool. So I'm hopeful for that. So I don't know if anybody else on our team had anything to add.
Talk real,
Oops,
sorry.
I was just going to ask if you could explain the onboarding specialists. I mean, obviously I know what they do, but is their sole function to do what?
Their sole function will be from from the time I offer, they're going to do references, background check, licenses, set them up for our new employee orientations. They're going to work with the hiring managers before these people even start, reach out to them, ensure that they're reaching out to their new hires before they start. We're going to have multiple touch points with our new hires along the way because sometimes people don't start right away. So we want to ensure that we're continuing that multiple touch point throughout that whole process, keep them engaged with us. We also implemented where we're adding swag. So when they come on board, they're getting some swag as well. So they're going to be responsible for making sure that that inventory is still staying up to point. And then they'll go in and meet them on orientation day and then just check in with them a few weeks down the road after they've started to see how things are going.
Thank you.
You're welcome.
Excellent. Thank you, Marissa. And let's see, Laura, was that you that spoke up before as well?
Yes, I was just going to mention that we talked about using software available to recruit, like Latrell was talking about Paycor, and I mentioned that we went to Paylocity and one of the members has experience with Paylocity, and we talked about the issues with that when you have, like, I'm a department of one, so I depend on the hiring managers. And so what access do we give hiring managers to the various platforms we use? So we talked real briefly on that.
Okay.
Might not have been so helpful to them, but it was for me.
Yeah. No, I mean, that's definitely an interesting thing that I hadn't thought about with the recruiting software is yeah, who outside, if you have a small or a one person recruitment team, like, you know, it's easy to say like, oh, you should, you know, assign people different tasks, but yeah, kind of challenging to say like, well, what kind of access do they get to information they need to do those tasks, but, you know, can also have a chance to throw the system into disarray. Yeah, all right, excellent. Well, let's see, anyone else from group 2? Anything else anyone wants to say? Okay. Well, sounds like you had an excellent discussion as well. And we will jump over to room 3, which was Jonathan, Pamela, and Sydney.
We were fortunate enough that all 3 of us work for federally qualified health centers, so we had that in common in our discussion. And challenges are just competition with the local hospitals. I was just looking at our competitor, and they have 25 recruiters, and we have HR staff, and I'm in the marketing and facilities department that have just been brought on for the branding part of it in our recruitment. So we struggle. We have about 67 open positions that I last checked as of yesterday. And again, we're seeing, you know, the great resignation is affecting us. I'm in Norwich, Connecticut. So we're halfway between Boston and New York. So people seem to maybe live in Connecticut, but, you know, travel to one of those cities. Our success is our mission. You know, what we do every single day as a federally qualified health center is amazing. We are not adding anybody to our recruitment team, but I like the idea of an onboarding specialist. It is our budget season, so I am going to bring that up. And, you know, somebody said Jonathan, and her name's not Jonathan. She's just sitting in Jonathan's computer, said, you know, working with anybody and everybody. You know, her friend is a nurse, and she's like, hey, are you looking, you know, to work somewhere else? And that's pretty much the same with UCFS. Anywhere, anybody, any organization, colleges, high schools, tech schools, anywhere you can find somebody. I don't know, the other 2 in my group, did you guys have anything to add?
Well, I can say for myself, what is very interesting is I'm in a unique position. I've only been with the company for about 6 weeks. So I'm really new to coming into this. And prior to me, there wasn't an HR person for 4 months. So it was really dispersed everywhere. So trying to pull it together into a uniform plan and getting that prepared, it's quite the challenge, but it's also very interesting, gives me a whole new perspective. Hopefully adding more people as far as that, you know, we went from an HR department, so we don't have recruiters, it's all HR. And then right now, the site directors and such are the ones who are working to be hiring managers at the same time. We'll go from a department of 0 to 2. So that's an improvement. But the biggest challenge I'm running into is seeing that people are not really wanting to have the life-work balance. They would rather be working in a hospital situation on call, long hours in order to get the income, the paycheck, as opposed to being in an office Monday through Friday with your weekends free, no on call, you know, benefits, you know, everything along that line, but they're actually looking at what's going to be going into the bank instead. And that's been a real challenge.
Yeah, I mean, that's very different than a lot of what we normally hear, but yeah, certainly money can be a draw, and people are willing to work a lot for it. Have you noticed that change more recently, or is that been kind of, I mean, I guess if you've only been in that position about 6 weeks, but.
Yeah, well, I was going to say the industry I came from, I was in, you know, public utilities. And so with that, it changed tremendously. It was the same thing. I left there with multiple positions open, and we never had positions open before because people were not showing up because they got an offer the day before that was $4 or $5 more an hour. And so I think it's all industry wide. I just think it's the nature of the beast that we're all dealing with right now.
Wow.
You know,
Well,
Melissa,
yeah.
one of the things that I just did, we've had someone who is leaving us for private practice, and I looked at the total rewards. And you know, what are you going to be spending in, you know, your own licensing, your own, you know, you're never going to get vacation, right? And it was about $25,000 that wasn't, you know, salary related that he was walking away from. And that was a much different conversation than just, you know, oh, I want to go out on my own.
Yes.
So.
Yes, my previous employer, every year, every February, we would send out a benefit summary statement, basically your value to us. And it was amazing. People realized that their income was actually only about 46% of what their value was to the company. And so when you start looking at it that way, it really does make a difference.
Yeah, no, I think that's a really important point, that it's very easy to not see the kind of intangible, but the benefit side of things. I mean, just what you pay in health insurance, if you're paying on your own versus an employer paying it, is massive. And so, yeah, really important to make sure people are aware of if they leave and go somewhere else where they don't get that, whether it's private practice or working, like you said, sometimes the hourly positions you might make more in overtime, but you lose it because you don't have the benefits. Yeah, wow, really excellent points. Terrific. Anything anyone else wants to bring up? Okay, well, thank you all so much for sharing. Sounds like you had really, really good discussion, so I'm really glad. And yeah, a good mix of understanding the challenges, but also some really cool options for working around them. And congratulations to everyone that's getting to have a little more help after working as a team of one or two for a long time. So we're gonna move on, and we've got a little material to cover. We're gonna talk about recruitment priorities and just kind of discussing what matters. And obviously this is going to vary for everyone. Like Melissa was saying, you know, sometimes it's just about the money. But also, let's see, I think Pamela said that the mission is their big success. And so it's going to depend on the candidate, but that can help you understand who you want to reach out to. And so just kind of defining your big picture priorities and making sure to emphasize those JEDI principles. Because again, you know, if you're looking for people who are really mission driven, they're usually going to care about those JEDI principles and want them to be very integrated into the work they do. And then obviously using your strategic plans, you know, looking ahead to see what can we expect to have as far as openings coming up that we might need to start recruiting now, or we can at least start planning ahead for that. And then obviously keeping all of that updated, which is obviously easy if you're just one person running your whole department, right? And then other things to consider. So, you know, obviously your immediate vacancies are probably going to take priority, but we also want to understand reason for vacancies. Again, going back to that piece of, are people leaving because they just want more pay? Because that can also help us understand, like, should we invest more in benefits, or should we look at how we can give people a little bit more take-home pay, or flexibility to work more hours if that's something that, say, part-time staff want. And then how much time is it taking us to fill positions? And I think that's a really big one, and that can be challenging, obviously, to assess, because it's going to change as the job market changes every year. But then the investment side of that, so looking at recruitment as an investment, and we have to plan and budget for it, and, you know, understand that, you know, as long as we're putting money into retention and we're seeing retention, and that's a really good use of that, because turnover is very expensive. But then also being sure to kind of budget aside for times when there is turnover. And that's where that long-term planning can come in as well, and saying, you know, oh, we have someone who we know is going to retire, or we've had a really honest conversation with some people who say, look, I want to go into private practice eventually. And it might be, I want to go into private practice next year. That's a little harder to deal with. But if it's like, oh, I want to work for, you know, 4 or 5 years, and then I do want to go into private practice, if you can have that honest conversation, it can help you plan ahead of time and say like, well, we've got a good employee right now. We're going to make the most of that, and we're going to plan ahead for their replacement. And so looking at that recruitment budget, there's obviously all different factors that go into it, right? There's the person hours that go into it. If you're paying for an outside recruiter, it sounds like a lot of you are inside recruiters or have some sort of inside recruiting going on, which can obviously be much more efficient than having to pay an outside organization, but sometimes you just don't have the people to be able to do that. And then the expenses associated with an interview, you know, especially for some of these positions like clinicians and stuff, where you're going to be bringing them in for an interview, might be bringing them in from out of state, depending on, you know, where they were doing med school or residency or their previous job or any of that. And so budgeting for those kind of expenses, and then just the other expenses that go along with hiring, that onboarding time, right? The ramp up time to get an employee from where they're kind of learning the ropes to where they're actually performing at a high level. So kind of accounting for that. And so again, turnover is like much more expensive because you have to deal with the onboarding process as well as losing that employee and the whole process of releasing them, you know, if they leave. And so we want to look at this as kind of a long-term cycle, because no matter how great an employee is, how long they stay with us, they will eventually leave. And so looking at all of that as a cycle, and we're going to have hopefully a longer term in that, which saves us money, but we still have to kind of look at that impending turnover. Okay, and then we have this financial assessment tool. You'll be using some of this in the homework after this session. But basically, it just helps you look through and kind of break down some of those line item costs of managing, you know, recruiting and, you know, onboarding and interview process. And if you use an outside recruiter and all of that kind of stuff. And so we'll talk more about that in a minute. But this sheet that's available there, that really helps to go through and think about all those little individual costs and help kind of come up with that recruiting budget. And then recruiting firms, again, it sounds like a lot of you are or have internal recruiters, which can be really useful. External recruiting organizations can be really helpful, but there are also ones that obviously don't work really well. And there might be ones that overall are good, but just aren't a good fit for your organization. So I think my biggest takeaway is if you're going to use some sort of external recruiter, and really whether it's a free resource or a low cost one, like say posting on Indeed or something, or you actually have a dedicated person who's going out and recruiting, is track their progress, like see how they're doing and see whether it's worth your time or money to manage that. And just saying, you know, if the recruiters bring you tons of candidates, but none of them ever work out, then it may not be worth it. And going along with that was something that Suzanne pointed out, was if you can negotiate a contract with an outside recruiter that is fulfillment based, right? So if you get a candidate and they don't stay for, you know, 6 months or a year or whatever, then, you know, maybe you don't pay or pay that recruiter less, right? It should be hopefully more fulfillment based. But, you know, that can also depend on what the recruiting organization offers. And again, if they're getting you a few candidates and all your other job posting sites and everything aren't getting you anything, then, you know, maybe they are kind of worth putting that money into and the job market's just difficult, or there's other issues that you might need to look at as far as what are those push-pull factors for finding candidates. Sorry, I almost missed that one that Michelle put in there. A lot of recruiting organizations have discounts for nonprofits and health center status and stuff like that. So definitely ask about that, because you don't want to, you don't want to miss out on that potential discount. So does anyone have any questions? I know we kind of ran through that quickly, but I think a lot of it is stuff that you're probably fairly familiar with. But sometimes just going through and actually kind of tabulating those costs can be challenging without a nice framework to go through it.
So on that worksheet, that would be our homework.
Yes.
Are you suggesting that we do it on an individual basis or on, like how many people we lost last month?
So let me go ahead to this. So this is what the homework documents are going to look like. And so as you see on the left here, you're going to kind of plot. I wonder if I can do this. So you'll actually be looking at specific positions. And so saying, okay, what's the full-time equivalency? And then is it currently vacant? Is it a planned vacancy? And you would do that for each individual position. Now, if you're a massive health center with tons of staff, you might shorthand this to look at departments. But in general, it's going to be a lot more helpful to look at individuals because you can also do that planning where you can say, oh, are they, what's our anticipated date of need? Right. And so if this is someone that we know is retiring in 10 years, okay, cool. We can note that on there. And as we get closer, we can start to plan for that. But if it's someone new, we don't know that they're leaving, we might want to have that conversation with them. Like, hey, we really like having you here and we like you to stay here, but we also want to be upfront and like have that conversation that can be kind of challenging of, do you see yourself moving on at some point? Because it's better to have that warning. If they say, yeah, I want to go into private practice eventually, like, okay, cool, we'll support you however we can, but like, give us as much heads up as you can so that we're not hit with that suddenly. So that's kind of the benefit of breaking it down by individual. But again, if you have a massive staff, this may be something where you approximate some of these numbers for a group as opposed to individuals.
And if it's okay, Alex, I'll just add one thing
Oh,
too.
yeah.
So I would totally second what you said as far as the priorities on the left. And on the right, if you can break it out by individual position, so all of the costs, that's great. And the great thing about this, the spreadsheet is that it's completely customizable. So if you don't have, that person that is a part of your recruitment or onboarding efforts, you don't have to include them. But, this is really designed to help you get an idea of the overall recruitment costs. And we were actually doing a training last week, and someone said, I've never seen our recruitment budget ever. And so I think what this is really powerful to do is to get an idea, just like Alex was saying, turnover is expensive. And so is recruiting. And so really, obviously it's an exercise for your health center to understand the total investment in recruiting. So, I heard, mention of, an onboarding person. How many hours does that person spend doing all the onboarding? How many hours do folks spend, setting up interviews? And then how much do those interviews cost? And if you're bringing in someone from outside the community, all of those costs too. So really, this exercise is really, really helpful to get an idea about how much all of this is costing in addition to turnover and all of that. But really the cost, so, on the flip side, and obviously we're not here to talk about this really in this setting, but, then when you think about retention and how much retention, on the flip side of that. So, thinking about, retention and that retention is cheap compared to, interviewing and onboarding and all that kind of good stuff. So I would say, individual, if you could do it on an individual basis, that would be great. And obviously this is all an approximation. You might not have these individual numbers, but, really just to sort of help you get an idea of the overall cost, especially if you're using an outside recruitment firm, this kind of things.
Yeah, excellent. Thank you, Suzanne. Yeah, so that's one of the biggest things with these is if you're thinking about offering something, say like retention bonuses, because you see people leaving for more money, you can assess your turnover costs and say, well, if we're going to lose a person every 18 months, it's going to cost us this much. Why don't we work on paying people closer to that amount so that we don't have that turnover? Yeah, does anyone else have any questions about the homework or any of the stuff we discussed earlier? Okay, well, excellent. And obviously, if you have any questions or issues, you can email Michelle or just our general info@chcworkforce.org. And then you can also email me if you'd like. I'm arolwing@clinicians.org. I can type that in the chat. But Michelle will be back with you next time. And so thank you so much, everyone. Oh, yes, we're going to launch the evaluation real quick. If you could take just a few seconds to fill that out for us. And then thank you so much. I think it was an excellent discussion today. I hope everyone enjoyed it. And we will see you all next time.